Hello and welcome to Forward Together for Mental Health, a programme from ITM Productions and Mental Health UK. All aspects of a person's life can affect their well-being, with many elements out of their control. The pandemic has elevated existing concerns for many as more face isolation, financial uncertainty and a lack of routine. Yet paradoxically, more are now coming forward and asking for help and support, especially men. This programme will look at the projects and initiatives across the UK as we all go forward together for mental health. I'm joined by Brian Dow, Chief Executive of Mental Health UK. Brian, thanks for joining me. Now, Brian, the pandemic has brought with it a lot of physical and mental health issues, but it's also had a clear effect on people's mental health too. What impact has the pandemic had and how has it been addressed?
Well, I think from the outset, this has been a mental health pandemic every bit as much as it has been a physical health pandemic. Of course, the risk to life from the virus itself is very profound, but I think we've all become a great deal more literate in understanding that the effects of isolation, of grief, the worry about losing a job and financial difficulties, all impacts on our mental health. And I think both in terms of the governmental response, as well as the community response across the UK and indeed across the world, has put that fact at its core that actually if we're not attending and supporting our own mental health, then our physical health suffers as a result, and vice versa. So I think actually, although the pandemic has been a hugely profound and damaging episode, of course it has, for millions of people, one of the positives that arises from it, I think, is that we all understand how to support our own mental health and the mental health of our friends, our colleagues, and our family.
How have things changed in how mental health has been perceived by the general public, employers, and in the media in recent years?
There's been a huge shift in the way that we think and talk about mental health over the last couple of decades, really. I think firstly, you saw a number of celebrities coming forward in the last 20 years or so, and that's helped build this public mandate. After all, we all have mental health, and we began to see the political parties making commitments in their manifestos, and in turn, happily, that's led to a much greater prioritisation across the National Health Service. And in time, what we're going to see is record levels of funding going in. Now, the reality is that we've still got an awful long way to catch up with physical health. Employers are beginning to understand that if they don't attend to the needs of their employees' mental health as well as the physical health, then that frankly in turn begins to affect their bottom line, because of course mental ill health is a huge cause of absenteeism. And in terms of the research and the understanding of conditions that exists out there, there still is a great distance to go. But we're making progress, and I think the hope is that perhaps in the next 10 or 15 years, we can really begin to talk about parity between mental and physical health.
As you say, just like physical health, everyone has mental health too, even men. Have we now got beyond that stereotype of keeping a stiff upper lip?
I think we're beginning to get there. And certainly campaigns like the Time to Change campaign, which was run over the last 10 years, designed to kind of break down the stigma and misunderstanding around mental health, have helped. They've demonstrated to people that actually 1 in 4 of us have a mental health problem at any given time, and that therefore you will know somebody in your social circle or your family circle who has a mental health problem. And that's encouraged that kind of desire to talk about mental health. But talking about mental health, and certainly talking about mental illness, doesn't solve it. I think we've still got a great distance to go before we have a genuine kind of level of understanding about the complexity of mental illness and how that results in people's lives becoming sometimes incredibly difficult. So I think, we're making progress with getting rid of that stiff upper lip, but I don't think it's completely evaporated just yet.
Do we all have the responsibility to look after people who might be suffering from mental health, be that in the workplace or school? How should someone approach doing so?
Well, it's interesting that latterly we've seen sports stars talking about how they need to take care of their mental health and their physical health. And that's been a bit of a shift, to say the least. Over the last couple of years, we've seen really big employers coming forward and talking about how they want to put mental health at the core of their strategy, because they recognise that it's good for their employees, but it's also good for the bottom line. If your employees are not performing because of the mental ill health, then your business is going to struggle. And I think fundamentally the pandemic has made us realise that mental health doesn't just exist on its own. All those other factors, like your financial situation, the security of your job, is your house, your home safe? And are you feeling isolated from your social circle? All those things matter. So I think that notion of being there to support somebody who's struggling with their mental health, making sure that they are able to talk about it, but actually encouraging people, if they have a problem at work, perhaps to seek assistance through their employee assistance program, or indeed, perhaps if they are struggling in terms of the wider mental health, to develop that relationship with a doctor and to seek that help and not to feel alone. I think that is the responsibility that we all have as friends, as family members and as colleagues.
Brian Dow, Chief Executive of Mental Health UK, thanks for joining me. Mental Health UK and Lloyds Banking Group launched their partnership in 2017, aiming to raise £4 million over 2 years, establish a mental health and money advice service, and significantly change the mental health narrative for colleagues and customers. Since then, they've extended the partnership and more than trebled the amount raised, enabling the development of the Bloom programme, which equips children to be more resilient as they transition into adult life.
At this East London school, young people are learning about resilience.
We need to help each other, especially after the year we've had.
They're on a 6-week course called the Bloom programme, which helps them cope with the transition into adult life. It's run by Mental Health UK and funded by Lloyds Banking Group, two organisations who formed a partnership in 2017 to change the narrative around mental health.
So we talk about self-esteem, we talk about managing low levels of anxiety, managing your mood, and we talk about being able to navigate the pressures of a young person's life. Statistics show that 75% of mental illnesses will onset before a young person's 18th birthday. So we want to make sure that young people have the tools to perhaps stop their mental health difficulties from deteriorating and developing into something more serious.
I learned more about my own mental health, how I feel, as well as my physical well-being.
Just looking at how to manage your time, definitely from a young age helps us.
If you're always stressing, then you're never enjoying, and that doesn't sound too good.
Lloyds Banking Group's partnership with Mental Health UK has already exceeded its £4 million fundraising goal. It secured over £11 million and plans to expand the Bloom programme and other pioneering projects within the financial sector. One of those projects is the Mental Health and Money Advice Service, which was set up with Lloyds funding. Its specialist advisors help thousands of people with mental health problems who are struggling to manage their finances.
There's a huge connection with mental health and debt. They have maybe developed mental health due to stress, depression, anxiety, because of debt, because of unemployment, because of breakdown of a relationship. So there's all sorts of factors that bring people to us. We look at the client holistically and try to get them a resolve holistically rather than passing them from one organisation to another organisation.
Lloyds was one of the first big corporates to introduce a mental health strategy. It's based on 3 pillars: reducing stigma, empowering well-being and increasing understanding. The organisation has 2,500 mental health advocates who support staff and encourage them to open up.
You see the struggles that colleagues are having, you experience those stories, and then you think about what colleagues actually need. What do you need to look after yourselves? Have you got a caring responsibility? Is there a particularly stressful situation that you need support with? So it's not just that we are ticking a box and giving an image out to the external world. It's about what we truly believe in as colleagues within the organisation.
I think when an organisation of the scale and dimension of Lloyds Banking Group entered this terrain with the passion and commitment that it did do, I think it really shifted the way that we think about mental health. The change they were able to make through their staff, their colleagues, but also through their customers and through the wider economy, I think has been game-changing, and I think we owe them a huge debt of gratitude.
Lloyds Banking Group now plans to build on its 5-year partnership with Mental Health UK by expanding projects like Bloom, by working further to remove the stigma surrounding mental health, and by continuing to promote better well-being in the workplace and beyond.
In May 2020, as the COVID-19 crisis began to bite, Mental Health UK, with support from Johnson & Johnson, pioneered the Community Mental Health Navigator programme in Grimsby. The navigators act as a single point of contact for those in need, helping them to navigate what can be a complex patchwork of support. They're well placed to help mentally vulnerable people get support with housing, staying connected and having control over their finances. And they can make a tangible difference to a person's quality of life.
Grimsby, once fated as the home port of the world's largest fishing fleet, is now emerging from post-industrial decline to lead the UK's fish processing industry and to innovate in tackling mental health issues in the community.
Grimsby and North East Lincolnshire have higher than average levels of deprivation, with issues around housing, money, drugs and alcohol adding to mental health challenges. But there's a new approach here addressing these social determinants of health. Teresa Harrison is the UK's first community mental health navigator, linking people to the services they need while reducing pressure on the NHS.
I help the local primary care network, and I also help the service users in that primary care network to liaise with mental health services. The whole point of the project, which was funded by Johnson & Johnson, was to reduce the impact on emergency services, also people going into crisis, and also trying to find out what's causing their mental health problems that they're going to the GP with.
This GP says 40% of the patients he sees have a mental health issue, but he has limited time to see them and isn't connected to the third sector or charity services that might help. He says the navigator role has led to earlier interventions and averted many crises.
It's been fantastic. We've all been blown away about the impact it has had. This care navigation role allows someone to properly sit down with them, often in a different environment, either in their own home, out in a coffee shop, providing a different type of relationship, which allows you to properly get down to what are the other problems that's going on in someone's life. This different way of approaching these problems is I think, going to be the future.
Teresa works with a range of healthcare professionals who serve some of the harder to reach members of their community: rough sleepers, sex workers, people with drug and alcohol problems. They help them with housing and benefits, as well as medical concerns.
People can turn up in crisis to Open Door. You don't have to be registered as a patient here. We do quite a lot of drop-ins as well. So having Teresa based here for twice a week is really, really useful. She's very successful. Really helped our patients out a lot because they know that they've got that one person that they can talk to, and then Teresa can link in with all the other individuals that are based at Open Door. So it's basically like a one-stop shop, really.
With the success of the navigator role in Grimsby, it's now being rolled out to other regions.
If you're experiencing a serious mental health problem, you probably don't have the confidence, you certainly don't have the capability, and you might not even have the capacity, the knowledge, to be able to get all the different kinds of support that you need. And the role of the navigator is acting in that kind of link point between the patient
and the health professional, finding those different forms of support for the person who maybe just doesn't have the wherewithal to do it in that moment of crisis.
Teresa says her own experience of mental health issues enables her to guide others.
I absolutely love it. It's holistic. It's about the person. It's about gaining their trust, and they know they're not on their own. And what I get out of it is seeing that person come out the other side and know that they're going to be all right.
Johnson & Johnson is a healthcare company guided by their credo. That's a mission that begins within the company. A statement of its values and purpose as they work to change both how they treat and perceive mental illness by supporting their employees first.
Johnson & Johnson has always worked to put a healthy mind, body and environment within reach of everyone, everywhere, as set out in its mission statement.
The statement, known as our credo, was first written in 1943. It reflects Johnson & Johnson's core values and has changed throughout the years, recognising environmental responsibility, the importance of the family and work-life balance.
The credo, has been around for more than 75 years. It's evolved through that time, but certainly it's a fundamental element of how we work. It's not just on the walls everywhere, but it is in how we set goals, how we set targets, how we evaluate ourselves and our teams.
Creating inclusive, safe spaces for their teams is a firm commitment within the credo.
By creating an environment where people can talk openly about their mental ill health, then firstly you create an environment where someone says, I'm not well enough to be at work today. And so by being able to do that, then people can take the appropriate rest. And so when they do come back to work, whether it's a couple of days later or a week later, then they're a lot happier. They feel more included for being able to have that conversation.
The Alliance for Diverse Abilities is a relatively new resource group for employees, which has seen a huge increase in membership in the UK. Group member Samantha Valentine won the Employee of the Year award for her work supporting colleagues.
She started helping other people at work after struggling with her own mental health. She found the strength for that when she realised Johnson & Johnson were fully supportive of her push for more openness.
That's something so important. If you have leaders and other colleagues that are around you where you can say, this is who I am and here's my story, and that has been such a turning point to be able to, where I was previously petrified to speak to a line manager about it or something of that sort, I just went, no, I'm safe here.
I think what the last year and a half has certainly taught us is that dialogue, first and foremost, is the critical first step to supporting all of our employees through the various mental health challenges, honestly, that we've all been facing.
Johnson & Johnson is also passionate about supporting community programmes to provide assistance to those that need it.
I think it's really imperative for organisations, for businesses, for community organisations to really think about what the opportunities are to help increase access and support for mental health in the community.
The company is committed to advancing mental health for the world at large.
We've been very committed to trying to make a difference in mental health, certainly with our research efforts, but also to try and reduce stigma, to raise awareness, and to think about holistic solutions. The World Economic Forum has projected that mental illness alone is going to cost society more than cancer, diabetes, and chronic respiratory diseases combined. So it is staggering, and we need to work together to do something about it.
Johnson & Johnson knows that to achieve its ambition to change the trajectory of human health, it needs a healthy workforce.
We measure employee engagement through a survey throughout the year, which is our J&J Credo survey, and we've actually got a fantastic result, particularly this year, around having a company where people feel like they can bring their best selves to work, and a company that's really passionate about health and well-being specifically.
According to the NHS, 1 in 3 of us suffer from poor sleep, and this can have a devastating effect on our lives, impacting both our physical and mental health. Sleep Station is helping tens of thousands of people all over the world to tackle their sleep problems and achieve happier and healthier lives.
Lily, like millions of others, has struggled to sleep. It's left her feeling physically and mentally exhausted.
I would go to bed early, wake up and then just sort of lie in bed thinking I'm not getting to sleep, and that would just get me really wound up. Going to bed exhausted, but then waking up with thoughts going around in my head about what I hadn't done that day or what I needed to do the next day.
And being constantly exhausted wasn't great for family life either.
Being irritable with the kids, they'd do something really minor and I'd sort of jump at them, so that was not nice. Obviously husband as well, he would take the brunt of any issues that I might have with irritability. And work is, I'd really sort of try and focus on work and make sure I wasn't making mistakes and things there and trying to be on the ball, so that would take out a lot of my energy.
If we don't sleep well, we pay the price for that. Sleep is about balance, it's about what we call homeostasis, keeping the whole system running correctly. So if you improve sleep, you can see a commensurate reduction in depression scores or anxiety scores or pain scores. You actually feel less pain if you've slept well. So because you then have the benefits of sleep, you are then more motivated. You're more able to exercise, eat healthier, or even just be motivated to get well. So pretty much for any condition, fix sleep first, and you make everything else that you do after that so much easier.
At Sleep Station's headquarters in Newcastle, Dr. Stanley is part of a multidisciplinary team using an evidence-based sleep improvement programme to give patients like Lily a route out of insomnia. Patients can record their sleeping patterns for Sleep Station to analyse.
So the real bad sleep was red, and then mild insomnia was the orange, and then normal was the green.
And each person receives a personal sleep improvement plan, along with the support and encouragement needed to implement it. This personalised approach is what makes Sleep Station so effective.
All the way through the programme, I was able to message the coach and they'd reply straight back. And that was really nice because it felt like there was somebody there supporting me.
Video resources also provide help and advice to each person on their journey towards sleep improvement.
Let's think about what things are going to make your bedroom perfect for sleeping in.
Sleep Station is really helpful for people who are experiencing insomnia symptoms because they get all the support that they need at exactly the point in time that they need it. So what we find is our digital sleep service is just as effective as seeing a clinician face-to-face to it because it is a personalised service. You are assigned to a multidisciplinary team of coaches, therapists, psychologists, psychiatrists. But by delivering it digitally, it allows us to do it in a much more cost-effective way, which is good for the individuals who purchase the service privately and also good for the NHS, where we support thousands of patients every year.
Before signing up to Sleep Station, anyone that's suffering from insomnia can complete a free assessment. It's a series of multiple choice questions to assess which of Sleep Station's courses are best suited to you.
For the most of us, the problem with our sleep is behavioural. It's the way we live our lives, the way we view sleep. And so the National Institute of Clinical Excellence say that cognitive behavioural therapy is now the first-line treatment of insomnia. There's no medicines involved, there's therefore no side effects.
And by supporting Lily to change her thoughts and behaviours, she's now reaping the rewards of a better night's sleep.
I just feel happier, in a better mood, just enjoy life more.
You've all noticed the difference?
Before, she always got really stressed out. She was constantly yawning, and she just really lost her temper lots.
She's a lot calmer and more collected towards the whole entire family.
It was the fear of sleep and the lack of sleep that was causing a lot of the anxiety. So, just going through the program and understanding that you have good nights, bad nights, and getting a nice routine to her sleep has helped kind of take that anxiety away.
delivering both peace of mind and a peaceful night's sleep.
Recent studies have suggested that 1 in 5 people are unable to manage stress levels and pressure at work. Global energy company BP recognises the importance of caring for their workforce and have implemented a mental health strategy focused on advancing the mental health agenda for both employees and communities.
Promoting the mental health of BP's workforce, some 64,000 people around the world, is enshrined in the company's sustainability frame, a commitment that includes enhancing the health and well-being of its employees, contractors and local communities. Reducing the stigma of mental health is a principle that BP are embedding in their workplace culture, enhancing the well-being of staff and of the wider communities they serve. Chief Executive Bernard Looney takes an active role in leading BP's mental health strategy. He's talked personally in one of the company's This Is Me podcasts, runs global Keeping Connected webcasts for all employees to join, and appoints leaders who demonstrate care with business acumen, an empathetic edge, as he calls it.
From a global perspective, I think mental health is on the same scale globally as climate change. The amount of energy that we all spend dealing with all of this stuff in our heads that we're worried about sharing, or that somebody might think there's something wrong with me, if we could help release that and have it be okay to not be okay, which of course it is, imagine the energy that we'd release for people to be able to collaborate and get on with their jobs and focus on the things that we want them to focus on.
Not being okay was something Charlie Wheeler was experiencing when he joined BP 4 years ago. Yet he found that his need to take time off for therapy sessions was fully supported. He says the company's extensive well-being resources saved him.
I feel very lucky, and I shouldn't feel lucky. It should be the normal. But I feel very lucky to work for a company where, you know, I can take 15 minutes to walk my dog if I need to and no one asks me questions, no one's chasing me to be back at my desk. I can attend appointments whenever I need to. They make it very clear, and that's one thing I've really noticed stepped up since the start of the pandemic, is if you need help, talk.
A promise to enhance well-being is clearly identified as one of the company's core aims. A toolkit of resources like leaflets, a meditation app and a global employee assistance programme provide practical support. Identifying hotspots so that care can be delivered where and when it's needed comes from BP's pioneering data-led approach.
The Wellbeing Index is a monthly survey. It's a random sample of people and their responses are completely confidential. But we are able to look at the trends, both in sort of where and what the trends look like. So when the Wellbeing Index is going up, we know people are feeling better, but we also know other things that are important for business are going better. So better safety, better engagement, and actually better retention of staff too.
Training is offered to all staff in mental health awareness and resilience. Managers receive coaching to support their teams.
We have a network of employees who are mental health and wellbeing champions, and they volunteer to be a part of this role. They are trained, and actually there would be peer-to-peer support for individuals within the organisation, and then people might not want to speak to their manager. They can go to another colleague who would really encourage them and make sure that they're aware of resources and support available.
BP made their biggest ever charity donation to the mental health organisation Mind, supporting individuals, communities and the businesses they work for.
The very generous donation from BP to Mind has enabled us to continue offering the services that we've been offering, but also scale them up in response to the COVID-19 pandemic. So that's things like supporting our network of 120 local minds to deliver services to their local communities, such as talking therapies, counselling, those sorts of services that previously were delivered face-to-face, that they've now been able to move online and help more people.
Helping more people is what BP's mental health approach is all about, making a difference on a personal and a business level.
Recent reports confirm that the cost of mental health to business is extremely high and continues to rise. The critical role that managers play in employee well-being is well documented, and training created by Ripple & Co. places managers in simulated situations where they gain the confidence needed to assist team members experiencing mental ill health.
I'm so sorry to hear about your mum. How is she doing at the moment?
In the heart of the city, a conversation that's close to the heart.
I do feel like I just need a little time to kind of just to catch up with everything at home and just get my head sort of back into place.
These specially trained actors are role-playing real-life workplace scenarios where a line manager is listening and talking to a colleague who's experiencing poor mental well-being.
I'll allocate enough time so we can have a catch-up with each other as well. I would like to start doing that more regularly if that's okay with you.
And for the staff at this bank who've been observing and feeding back, there's also an opportunity to practice these conversations for themselves.
Are you okay? It's racing. That's all right, that's okay. Do you want some water or anything? No, I'm actually... It's been really interesting actually, because it's just taken some time out as a manager just to sit and reflect about the conversations that you're likely to have.
Do you feel lonely?
Yeah, like, I know it sounds a bit sad saying that, I'm like so young and stuff like.
Not at all, not at all.
It's been excellent training, and actually seeing it and hearing other people and how they deal with it, you can take a lot of their skills away with you.
I broke up with my partner.
Oh, I'm so sorry to hear that.
We've been together for about 8 years.
The old adage is, you know, happy staff are productive staff, but it's very true, and I do think it's important to treat people as humans before you treat them as employees, because everybody has something going on.
And then it's about encouraging them to seek support from others.
Role play is central to the TalkWorks training from Ripple & Co. And Eileen Donnelly, who developed it, believes it can build confidence in managers to have the authentic conversations needed to humanise the workplace.
This is not about talking about the conversation you would have, it's actually having that conversation. And I've based the whole product, the whole training solution on Culp's experiential learning model. So the idea is you observe something, you reflect, you experience it, you reflect, and through that practice and actual direct experience of it, that's where the learning really takes place.
Rather than thinking about the theory of it, they're actually having the experience of having that conversation, but in a really safe space that we've created for them, where they can make mistakes. They can stop halfway through if they want to, rewind, they can get some ideas from the rest of the group as well. So we're not kind of rigid. Have you spoken to your doctor about it at all? Have you?
Well, not really, because I don't really know exactly whether you should speak to your doctor.
And while working with different organisations, great efforts are taken to ensure the role-play scenarios are realistic and relevant.
We find out what maybe are the issues for that particular organisation, and then we will do research. So we will speak to people with the lived experience, and then we use those actual words in the script. So we craft it around the real experience, the real lived experience.
Well, look, what's important for us is to find something that really works for you.
And while here they have a well-being strategy and resources for their staff, the COVID pandemic is a reminder of the role all employers can play in promoting good mental health.
Workplaces have got a huge responsibility, but what I've been amazed at is how it's been embraced over the last 5 years, and I think it's brought more into focus now. So although one doesn't like to think of COVID as a good thing, but I think it has woken a lot of people up to that whole wellbeing agenda, and I don't think you can ever overdo it, because there's no downside with trying to have a go at creating good wellbeing in a workplace.
Line managers are crucial to employee well-being and spotting the signs of poor mental health, and training them to feel confident about having these meaningful conversations can result in healthier, more motivated and productive workplaces.
According to research by Bupa, 80% of teenagers have suffered symptoms of poor mental health since the start of the pandemic. Mental health experts at Bupa are encouraging parents to know the warning signs and regularly check in with their children to see how they're coping. Prior to the pandemic, Bupa launched the Family Mental Health Line for customers, which over the past year has seen a growing rise in the number of calls.
Have you noticed a change in us since we've been in lockdown and through lockdown? Has it got worse?
The disruption caused by the COVID pandemic has brought an increase in the volume and complexity of calls from Bupa members to its Family Mental Health Line.
The pandemic's had a significant impact on people's mental health, and that includes children and young people. What we've seen particularly is the effect that the disruptions had on their routine and education and how they socialise. So in effect, what's happened is the key experiences that shape who they are as they grow up have been disrupted.
And research commissioned by Bupa in the autumn of 2020 found 3 in 4 13 to 19-year-olds had experienced physical health issues related to poor mental health. Half had turned to harmful coping mechanisms, including drink, drugs or self-harm, to alleviate symptoms. And 45% of parents said they needed more guidance on how to talk to their teens about mental health.
Lockdown has allowed parents to see firsthand some of the behaviours and obsessional traits that could have remained hidden, and which prior to the pandemic they'd been unable to see.
The Family Mental Health Line is a dedicated line that's separate to any other lines coming into Bupa that parents can call in on, that will come directly into the mental health team. As a parent myself, if your child or your young person is struggling, you can have a tendency to think, oh, it's their teenage years, oh, it's their moving schools. You always try and put some reason and rationale behind what's happening to your child. You wouldn't naturally think, oh, it's their mental health well-being. So it's specialist conversations that will be taking place to explore what's going on for that young person and what advice and guidance is needed.
And in the case of one mum who called when her teenager started to struggle, support was available for both parent and child.
Prior to lockdown, the young person was very much engaged in activities of sport inside and outside of school. When lockdown had hit, that structure and routine had kind of gone out the window. They were struggling to manage. Mum being at home a lot more with the lockdown, she was able to identify that there was over-exercising, there was restriction of food, there was weight loss and irritability. And we discussed what had been going on. I was able to give her some tips and techniques of how to manage, and this support was consistent over a couple of weeks until the young person actually wanted to engage. Mum called back in and we was able to formulate a treatment plan.
And what's important here is that we also are here to support you. Often the parent will ring in, they'll talk at length about their child and what's happening, and resolution can be brought to that in terms of identifying what's needed. And then the question that's always asked is, how are you? And I think that's the significant moment where most parents will break down, and it's like a volcano erupting in terms of emotional state, emotional well-being, and it brings that opportunity for that parent to say how they've been affected.
At Bupa, we understand that mealtimes can sometimes be a stressful experience.
With online content as well to support both children and their families to better understand mental health, the focus is very much on early intervention.
The earlier that someone does receive that help and assistance, the better the outcome is likely to be. So therefore, if you are worried about somebody, or then they're not being themselves, then do start up that conversation and ask them how they are, because if they do need to access help, then it is better that that's done sooner rather than later.
Bupa is continuing to expand and upskill its mental health team, giving children, young people and their families the advice, guidance and support they need every step of the way.
Young athletes are always encouraged to look after their physical health, but their mental health is all too often overlooked. Your Resilience is a mental resilience programme designed by Mental Health UK to support 14 to 18-year-olds in elite sports pathways. They've been working with the Rugby League World Cup 2021 team and Rugby League Cares to launch the initiative, which has been successfully introduced at rugby league academies across the country, including the one at Bradford Bulls.
These players are on a scholarship programme with Bradford Bulls Rugby League. Many are hoping to be the sporting stars of the future.
Obviously, I want to get to the Super League and represent my country one day.
Biggest dream, playing professional rugby for Bradford.
You sure you're going to do it?
Well, it's not certain, but I'm going to try.
Becoming an elite sports person is tough, not just on the body, but also on the mind. So you need to build up mental resilience.
There's a number of pressures, from selection, injury, recently through COVID and missing out on debuts, and they have to work away from the rest of the group so they can feel isolated, can get down because they're not doing the things that they love to do. Going back onto our workshops on resilience from Mental Health UK, what is resilience?
Not giving in to peer pressure.
To tackle the problem, the players are taking part in a mental health programme for 14 to 18-year-olds called Your Resilience. It was created by Mental Health UK and delivered with Rugby League World Cup 2021. The aim is to reinforce how mental and physical well-being go hand in hand.
They go down a particular track, which means that they're not getting some of the other aspects of education that the rest of us might get. But in truth, because elite sports is a pretty brutal industry, only a very small select few actually make it, the effect on sports stars' mental health is really profound.
Sports stars are starting to speak up. At the Tokyo Olympics, gymnast Simone Biles pulled out of the team final to focus on her mental health. Research shows 75% of mental illnesses start before a person's 18th birthday.
We do Your Resilience 14 to 18-year-olds that hopefully we can put the support systems in place that by the time they get older and start to deal with more harder situations, more challenges, that they understand how to deal with it. And I think that comes again with as well that cultural change, ensuring that you have mental health guidelines and policies and resources and subjects, and athletes understand who it is they can go talk to.
Jodie Cunningham knows pressure. She's a seasoned England international and is also an ambassador for the Rugby League World Cup 2021. She's had to endure injuries and most recently the disappointment of the World Cup 2021 being postponed.
It is different for women. You've got to plan when you might have a child, and a lot were planning after this World Cup to take that break or possibly retire to have children. So everything has to refocus. We've now got 12 months to be even better, and I think that's how I've tried to focus it, but equally the rest of the girls have been brilliant at pulling the positives out of having an additional 12 months to work towards the World Cup.
The women's team now has a welfare officer, and the Rugby League has introduced a mental fitness charter.
If you can't see it, you can't play it. All right? Are we okay with that?
Yep.
Let's go.
Real change happens when everyone is on board. Coaches, volunteers and staff are all trained as part of the Your Resilience programme. Rugby's a physical sport and players are under pressure to act tough.
I think it's a tough thing to come out and say. You might be struggling sometimes and talk about them things. And if you can do that, I'm pretty sure you can challenge anything that's on the field.
For these young players, juggling training, exams and their social life is not easy.
Training 4 times a week and then exams every day, revising. It's been quite tough. It helped me manage different situations from school, training, social life. It's helped me a lot.
I've had COVID a couple of weeks ago, so I've been out for a while. So I'm just coming back now. I've only been back 2 weeks, so just working on my fitness and stuff to get back up to where I was. Of course, it helps a lot with just general time management and planning stuff to reduce stress.
We're at a really good point now where we're changing opinions that actually that time also needs to be invested in individuals in regards to looking after their emotional and mental health as well, and I think that is happening. We're on that journey now. There's still a way to go, but I think it's really important that people speak out and programmes like this raise awareness.
It's hoped by helping these young players early, they'll remain grounded.
The loneliness of anxiety and depression is often one of the most debilitating parts of it, but knowing that you're not suffering alone can help enormously. Together All is an online mental health support service that allows people to realise that they're not alone, no matter what they're coping with.
I'm glad I joined Together All. It's a place where I can get rid of the weight on my shoulders, you know? Stuff that keeps me up at night. I feel like I'm sharing with real people going through the same stuff. People support me and I support them. And it makes me feel less useless on my lower days. The resources are a great place to actually work through my emotions and give me the tools to think about things differently.
Together All is for people with anxiety, depression and other common mental health issues. It provides a clinically managed forum where users can connect with other members who may be feeling similar, as well as offering guided courses and online journals and tests so that members can track their progress. It's a formula that's working.
As a social impact business, we balance the need to address a social issue whilst also building successful business. And I think that is core to our values and who we are. As a service offering, we are a digital peer-to-peer platform that is available 24 hours a day that uses the power of community to help people deal with their anxiety and depression. So we have over 300 organisations that commission us. We work with NHS trusts, we work with local authorities, we work with government agencies such as the MOD, with veterans, we work with a number of universities, big population of universities use us, and then we work with a number of employees, including private organisations, government agencies and charities.
The coronavirus crisis has brought mental health to the fore. The impact of working from home, isolation and financial insecurity has led to more people asking for help.
I think, especially as we're coming out of lockdown and things are still feeling so uncertain for a lot of people, there's still a lot of anxiety around, a lot of really, difficulties around emotional well-being. And I think for people to be able to come onto Together All and to feel part of a community, to feel listened to feel supported and heard, can really help ease that sense of isolation that might be around for a lot of people at the moment.
Can you explain more about your role as a wall guide?
So as a wall guide, we are essentially there to create a safe and comfortable environment for all of our members. And we do that by staying really tuned into the community and what's happening. We need to be very aware of particular levels of distress amongst members if they're really struggling. We then need to have discussions and make decisions about how best to support those members.
The services offered by Together All don't just benefit their members. In an era where the NHS is struggling dealing with the public's mental health issues, the resources provided by Together All are helping to relieve some of the pressure.
I think it's so valuable because it's available immediately. If anybody comes to see me, for example, I can tell them about it and they could access it on their phone or tablet or computer straight away.
Why is it so useful to your organisation? What impact has it had on your organisation?
They like feeling that they're not isolated with their problems because they can share through the peer support network and get suggestions for things that have helped other people, and then they can get the benefit of feeling that they are in themselves being supportive to someone else. So it's had a very positive effect from the feedback that I've had.
It's available 24 hours a day, so at any one point someone can reach out to it. And it's clinically moderated, so they also know it's a very safe place. So if someone needs extra support or there's an emergency, that individual will be looked after. So it provides a safe, supportive place for their members.
I'm not fixed, but I definitely notice a difference in myself. I cope with my issues better, and I've gained a new perspective from listening to other members. I think everyone should have access to this. It can benefit anyone, not just those who are struggling.
Together All is continuing to grow quickly and has expanded to the US and Canada and are due to offer their services in more languages too, meaning that in these difficult times, many more people will hopefully find themselves part of an online community that will help to substantially improve their mental health.
New guidance from the Financial Conduct Authority states that businesses must ensure fair outcomes and take on an additional duty of care for customers in vulnerable circumstances. VCX provides training for customer-facing employees and a live database that provides instant information to support vulnerable customers, bring compassion to the forefront of businesses, and to safeguard their own emotional well-being.
Updated regulations from the Financial Conduct Authority are a challenge for businesses who are used to prioritising profit rather than the mental health of customers and employees.
There is this lens of vulnerability which particularly the FCA and many other regulatory bodies across other utilities in particular are putting on service providers to say, have you done enough? Have you done enough to understand this person's circumstances? And if you haven't, then we're going to hold you to account for that.
Having to discuss the personal issues of many customers can place a strain on the mental health of staff, which is why there needs to be a culture change in how businesses conduct themselves. Conversations with staff and their management led Chris to co-create the Vulnerable Customer Experience, or VCX, an e-learning platform which trains employees to deal compassionately with people who might be struggling. One module on purpose and culture draws on research by Alex Edmonds, which used real-world data to show that focusing on staff well-being ultimately pays off.
So what I found was that over a 28-year period, companies that treated their employees well beat their peers in terms of shareholder returns by 2.3 to 3.8% per year. That's 89 to 184% compounded. So it finds that, simply put, companies that treat their workers better do better.
As well as the training modules, VCX created the Signpost Database, which offers helpful information on over 1,000 health conditions, financial situations, and life experiences.
The Signpost will give them a little bit of information about what the customer's actually disclosed, but most importantly, it will give them some tools to actually scaffold the conversation. And then it also has 4 organisations which provide professional support and counselling in those particular areas that have been vetted by us.
The Vulnerability Registration Service is also signposted here. Anyone can register their difficulties, ranging from mental health issues to debt problems. Organisations then access that information to identify who needs support. VRS training webinars are seeing high levels of corporate engagement.
Well, a lot of the organisations that we're speaking to see training as a key factor. So it's all very well identifying vulnerable individuals, but clearly customer service staff who have a huge amount of pressure on them anyway need that training and support to be able to work and offer people the right levels of support.
One of my members of my team, she was on a call with somebody and they started to mention that they were feeling suicidal or having suicidal thoughts due to a situation that the bank had put them into about PPI and charges.
Claire's team had no access to the VCX system at the time.
When you're talking about vulnerable customers, you're also dealing with not people with just suicidal thoughts or mental health issues, but actual physical illnesses, which sometimes they tell you what the illness is and you're not a GP or any medical knowledge, you don't understand what it is. Something like the Signpost is really good because you can just basically click on it and have a real overall view without going into too much information about what that illness may be.
In order to manage the well-being of both staff and customers, businesses will have to look beyond short-term KPIs.
You've got to look at the long-term objective, which is supporting our customers, building relationships, and really making sure that we're there for people. And that's not something that you do overnight. That's something which does take a length of time. You've got to realise that in the long run it will pay dividends.
Companies willing to invest in technology like VCX show they've understood that.
It really underpins a cultural shift within the organisation that says we care about our customers, we care about our staff, we recognise the fact that some customers and employees are going to have some really tricky conversations and we're going to support them through that.
One of the cornerstones of good mental health and well-being is having a safe and secure place to call home. Vivid is a housing association based in the south of England that puts the home at the heart of a supportive community and helps its customers through a variety of tenancy support services so that those communities can thrive.
You okay? Yeah.
Max Chambers owes his life to his dog, Panda. Before the pandemic hit, he had serious mental health issues. COVID exacerbated that. Max had to close his tattooing business, his income plummeted, and he worried he'd lose his home of 20 years.
From losing my father, the first of 12 deaths in a period of 4 years, that works out one every 4 months. And these were family and close friends who I lost. And coping with them, although I thought I was coping with them and everything else that had happened, in the end I wasn't. I thought, this isn't life. I was having extreme headaches, I was really ill. 2 brain scans in the year, called them cluster headaches, constant migraines, couldn't sleep at night through the bad thoughts.
Hi Max.
Hi Linda.
Nice to see you again.
And you.
Hello Panda.
Max lives in a housing association property in Surrey run by Vivid. He was struggling to pay his rent and deeply in debt. Max was referred to the company's welfare rights advisor. Linda visits tenants in their homes, advising them on benefits, debt and appeals.
An amazing difference. A lot of the support I got, like bereavement counselling, I didn't even know it existed. And they directed me and helped me with all sorts of things and how to handle bills and how to, there was a way to sort things out and move forward and help me mend myself, which is now, I'm at that point. It's brilliant. I don't know what I'd have done without them, seriously.
For Linda and her team, it's all about supporting people to stay in their own homes.
Our vision is that we'll build more homes and make bright futures for our customers. And for us in our team, that's about helping people to claim the benefits that they're entitled to and advising them about debt. So we can be really life-changing for some people. We can help them get the benefits that they're entitled to that sometimes they're not claiming or that has been stopped when it shouldn't have been. For example, last week, we got somebody just about £20,000 in arrears of benefits that they were owed, and something like that is really life-changing.
You're working on the dairy site in Portsmouth?
Yeah, those 3 properties there.
Vivid is a not-for-profit housing association with 32,000 homes across Surrey, Hampshire, Berkshire and Sussex.
Having a place to call home is integral to everybody's well-being, and so that's what we do at Vivid. We provide a home, a place that's safe and secure, a safety net, if you like, for when things go wrong. And we also provide it as a springboard so that you can live your normal life. The safety net's been really important, I think, in the last period of time since the pandemic, because that pandemic has hit those that are poorest in our society. And so we're there to help them gain employment, we're there to help them deal with their mental health issues, we're there to help them get digital skills, all the things that you need to be equipped with to live in the world nowadays.
Vivid supports 72,000 people in their housing, from 1-bed flats to larger family homes. The cornerstone is having a safe and secure sanctuary, but it's also about having a sense of pride and belonging.
What the pandemic has really highlighted for people is a sense of community. Many of Vivid's people live or work in the heart of these communities, understanding the importance of improving neighbourhoods, providing green space, getting people back to work, everything that makes a community thrive.
Integral to Vivid's success with its customers is championing mental health among its 900 staff. So-called stigma busters like Lauren lead regular drop-in sessions, encouraging people to speak out if they're struggling.
Stigma busters at Vivid are so important because the more that we get our employees talking about their own mental health and keeping them happy, the better service that we can provide for our customers. So throughout the pandemic, I struggled with my own mental health. I was feeling quite lonely and isolated, and I knew that there would be other people that were feeling the same. So as a stigma buster, I created a group on our Yammer site, which is our social media page internally, and got people talking about working from home alone and how they felt, and sharing tips and advice and experiences.
Max is hoping eventually to restart his tattooing business now that things are looking more positive for him.
On seeing that I was in trouble with the people at Vivid in all departments, at first with my rent arrears, not getting on top of bills, each individual advised me and has helped me so much, but they're really caring, truly. So it's a fantastic housing association company. They're just really fantastic people. Okay. They've put me on the right path.
Thank you for watching Forward Together for Mental Health. All our interviews and reports are available on the Mental Health UK website. The details are on the screen now. From all of us here, thank you for watching. Goodbye.